In the year 2024, the health system managed many health programs, health conditions ranging from infectious diseases, chronic non-communicable diseases, international, regional, and local collaborations. In St. Lucia, the life expectancy for men as of 2024 is 70.9 and for women 77.8. We continue to note reductions in the birth rate. A total of 1,619 births were recorded for 2023, representing a crude birth rate of 9.4 per 1,000 women of childbearing age. This is a 9.6% decrease from the previous year of 2022. The total fertility rate per woman of childbearing age is 1.28 compared to 1.58 in 2015. The total fertility rate for population replacement is 2.1. Respiratory viruses continue to circulate, especially in the last quarter of the year. We note the drastic reduction in COVID-19 cases from 30 cases per 10,000 in 2023 to 3.4 per 10,000 in 2024. However, we continue to see new variants of COVID-19, influenza A, influenza B, and respiratory syncytial virus. One new case of tuberculosis was reported in 2024 in comparison to 3 new cases in 2023. A total of 1,845 cases of gastroenteritis were registered by the Sentinel surveillance system. This represents a 14% increase in cases from the previous year. 23% of those cases were children less than 5 years of age. Elevated numbers of cases were seen in the first month of the year, with 2 outbreak periods during April to May and also in September. 24% of the cases were from Grosley, 20% from Castries, and 11% from Mico. There were 22 new cases of HIV diagnosed in 2024, which represents a 24% decrease from 2023. 64% of the cases were male. There are currently 982 persons living with HIV in St. Lucia, of which 57% are male. The Ministry of Health noted a significant increase in dengue fever in 2024 compared to 2023, with outbreak levels attained in August and in October at an incidence rate of 249.9 per 100,000. 34% of the cases occurred in the northern districts of Grosley and Castries. 54% of the cases were female, and 47% were within the 15 to 49 age group. Thankfully, no dengue fever deaths were recorded in 2024. A total of 14 cases of leptospirosis were reported in 2024, of which 86% were male. This represents a 40% increase over last year. No cases of malaria were recorded. 3 cases of methicillin-resistant Staphylococcus aureus were recorded for 2024. St. Lucia has noted 1 new case of leprosy, which represents a 93% decrease from 2023 to 2024. A national action plan towards the elimination of leprosy was implemented during 2024. The increasing impact of violence and injuries due to crime and motor vehicular accidents on the hospital system and the blood bank resources remains of serious concern to the health sector. Chronic non-communicable diseases continue to be a significant source of mortality in St. Lucia, accounting for over 75% of all deaths, with cancers, cerebrovascular diseases or strokes, heart disease, and diabetes dominating as the top 4 causes of death, respectively, for the last 10 years. Despite this, males are losing more of their potential benefit to society due to assault, land transport accidents, and chronic lower respiratory disease, specifically COPD, due to smoking. Females are losing more of their potential to society due to cancers, breast and cervical in particular, and perinatal conditions. Guided by the trends noted over the last 5 years and the data from the Behavior Risk Factor Survey, which was carried out in 2019, primary care or preventative health strengthening remains a major focus for the Ministry of Health. We continue to note low levels of health screening, increases in obesity, low fruit and vegetable intake, and limited physical activity among our population. In 2024, increased health facility closures and diversions for care due to environmental air quality issues were noted. Significant maintenance issues were required at the Viewfort Wellness Centers and the Cashries Wellness Center. Mold infestation was a major issue in several facilities, requiring significant resources for remediation, such as Foaso, Tiroshe Miku, Soufre Hospital, Babono, Bexo and Richford Wellness Centers. The smarting process for the Delse Wellness Center began in 2024 and is expected to be completed in 2025. 8 smart health facilities are scheduled to begin during 2025. These include the Canaries, Babono, Vanna, Grace, Foaso, Lague, Grerivier, and Fosse Jacques. By addressing both the infrastructural and maintenance issues, the Ministry aims to enhance service delivery, improve the working environment for staff, and ensure improved access to healthcare for the population. The Public Health Board notes the increased number of unregulated food establishments on island. Strategies are being put in place to work with them to ensure compliance with food establishment regulations to improve the safety of food being prepared for public consumption. We are also working on the finalization and implementation of the Food Import-Export Mandate. In 2024, universal health coverage led to the provision of cervical cancer screening and prostate cancer screening in primary care at no cost to the patient. In 2025, snakebite management and breast cancer screening will be included in the strengthening of the primary care services. In 2024, one of the major milestones for the Ministry of Health was the opening of the first phase of the Dr. Betty Wells Urban Polyclinic located at the Dr. Winston C. Paris Medical Complex, formerly Victoria Hospital. Both medical clinic and urgent care services are provided in a newly renovated facility offering extended opening hours up to midnight, including weekends and holidays. This serves to provide access to care to the Castries region, reduce the burden on the Owen King EU Hospital, and enhance overall healthcare responsiveness. Another important milestone in the first phase of the Dr. Betty Wells Urban Polyclinic was the successful completion and opening of the National Eye Clinic. This facilitates the provision of high-quality ophthalmic services and diabetic retinopathy to the population. The second phase of the Dr. Betty Wells Urban Polyclinic and the 24-hour service at the Grosule Polyclinic is scheduled for 2025. The quality initiative and the development of the National Blood Bank, the development of a national mental health framework are some of the priorities for the Ministry of Health for 2025. With this implementation, it is anticipated that the general quality of care and service utilization will improve moving forward. The Ministry of Health will provide the public with progress updates on the various programs and interventions during 2025.